Hello, everybody, and welcome to today's webinar, Meeting the Patient Where They Are. We are very excited to have Stephen Hunter presenting for us today. My name is Sabrina McCarley, and I will be the moderator for today's webinar. Before I turn it over to Stephen, I wanted to cover a couple of housekeeping items. The first is that all participants will be on mute. We are recording today's webinar. You should receive by end of day Friday an email from Zoom. In that email, it will contain a link to the recording and the handouts. For all NARA members, it will also be available on the NARA portal. That should be up live by end of day Thursday. That will contain the PowerPoint as well as the recording. We are hoping that the end of this webinar will be a very fruitful conversation. And so for the conversation and discussion component at the end, we will ask that you type those answers and discussions into the chat. Any questions that you have for Stephen during the webinar presentation, we ask that you type those into the Q&A. So with that, Stephen, I will turn it over to you.
Hey, thanks, Sabrina. And I am excited to do this presentation. I hope it'll generate some discussion, as Sabrina said. So again, do keep hold of those questions or type them in, and we should have a good 20 minutes for discussion at the end of this. So just a little bit about myself. So I'm a physical therapist, and I have a position at Intermountain Healthcare where I lead a team that does, I guess you could call it quality control. We call it internal process control, but we implement processes, everything from clinical processes to clinical education to different types of work processes. So this being one of those, trying to engage patients better. And we came up with some ideas related to helping train our therapists to better engage patients based on their age. And so the information we have, we put together a team that had people from all different age groups in that to give input on it. And then we took it to a larger group that gave us more feedback. And by no means is this a presentation you would take and just give to your group. This would really be something you would just use for discussion, because we may not have the right answers, and this may be also more applicable to our area of the country where we work, which is in Utah, Idaho, and Nevada. So again, Intermountain's a nonprofit corporation. We have 26 hospitals, services throughout the continuum, and about 40,000 employees that we manage. So, and I'll talk a bit more about that. So Intermountain's vision is to become a model, or be a model health system, by providing extraordinary care and superior service at an affordable cost. A big part of that is engaging the patient, right, to provide that extraordinary care. And I'll kind of finish with a little video clip of extraordinary care and what that means. And I like it because it involves these different age groups that we're going to talk about. So rehab services, which is within Intermountain Healthcare, again, as I mentioned, we cross the continuum from acute inpatient. We don't have skilled nursing centers ourselves, but we do contract with a lot of skilled nursing here in our catchment area. We have a home health agency, and we have close to 100 outpatient clinics. And then we really have a community presence because we're a nonprofit healthcare system that's been around for a long time, over 100 years here in Utah. So it's we're fairly integrated in the community. And part of what we want to do to meet this vision, which is partner with families and patients and providers and payers to provide care at the right time, in the right place, and the right price in the communities, is to optimize that patient experience. And I'm sure that's a main strategy for all of you in your businesses, is to optimize that patient experience, especially as we're in this value-based environment. And this is really important to all of us, but Intermountain Healthcare, 50% of our income at Intermountain Healthcare is now what we call at risk, meaning it's in either a contracted rate or a population health. And so we get paid essentially upfront for half of the income we have. So we're really in an environment where we need patient engagement, and we also want to be as efficient as possible to get the patient, through our system and back into the community. So first of all, rehabilitation providers, I think we have trouble engaging patients. And part of the reason, or part of the evidence for that is there's published studies, and this is with physical therapy, that 40 to 70% of physical therapists have no-show rate, or physical therapists have a 40 to 70% no-show rate. And there was a recent study that was done with a large group that found 70% of patients would no-show for at least one visit. Here at Intermountain, we just completed a study that we did. We looked at data from 2018 to 2021, and 45% of our patients referred to outpatient physical therapy through our EMR. We were unable to schedule them, most because when we reached them, a big chunk of them, at least 25%, said, I just gonna kind of wait. Let me just try some things on my own, or let me just wait to see if it gets better. And they didn't want to schedule a PT visit. So, and I think this is not just unique to outpatient. I mean, I know in a SNF or an acute setting, you kind of have this captured patient, right? They're not going anywhere. But I don't know how many of them would prefer, if they had total choice over whether they would have a therapy visit, if they would choose to do it every time. And I know that when I had done some work in acute, there were patients that weren't always wanting to meet with me for whatever reason. So I think that even though, this is a multifactorial problem, right? I mean, engaging the patient requires a lot of different things. But one of the ideas we had is maybe our therapists could do a better job at interacting with patients based on their age and the preferences they have and expectations they have. And then maybe if we interact with an 80-year-old differently than a 20-year-old, we might better engage them. And there's some evidence from this study that we did. Again, we looked at 24,000 patients over an 18-month period, and these patients were referred to outpatient PT through our EMR, and then a call center would call that patient to schedule them for the visit. And what we did find is that patients between 55 and 75 were had a 20% higher probability of scheduling a visit than those between 20 and 40. So we know there are age-related differences with patients on engagement. Okay, so let me just kind of give you a disclaimer, okay? So the information that I'm presenting is not intended to promote age discrimination. And even though we do have stereotypes, I'm really not promoting that. And I'm not trying to make blanket statements that all people in this age range are going to respond a certain way. They don't. We know that there are individuals. I mean, we know there are 80-year-olds that are texting and using social media. And so, but in general, I think we can look at some of these age categories, and there are some trends that we should consider. And so the purpose really is to do that, to help us better engage people, whether they're young or whether they're elderly. So this is some published information about these different groups. And we know that there's these traditionalist boomers, Gen X, millennials, Gen Z. And we know that somebody's determined these different age ranges for that, right? The traditionalist is now somebody who's probably 77, 78 or older. A boomer is somebody between probably 57 and 76, and Gen X, is somebody between 40 roughly and 50, mid 50s to late 50s, and millennials are 21 to 40, 42 roughly, and then we got the Gen Z, which is under 21. And there have been some different things that have been studied with these individuals in healthcare, and there's a few things that we can generally say, right? The traditionalists are higher utilizers. We know that because they're older. They trust the physician and medical personnel for their information. But they're getting to the age where others are making healthcare decisions for them. Boomers, they really tend to want one-on-one interaction with a provider. as opposed to a virtual one in general. They like personal relationships, but they're also in that category where they're advising others, typically traditionalists, for their healthcare. So we need to keep that in mind. The Gen X, we consider them kind of in the middle of the healthcare, right? They're probably, of all these age groups, the most expert. And we consider them kind of the chief health officer, probably for their family or for people they're taking care of. They definitely shop for healthcare. They're used to doing that, and they use digital information for their information. But these are also people that are very busy in the middle of their careers, and they typically really value efficiency in terms of healthcare. Millennials, again, 21 to 40-ish, 42-ish, they have tended to avoid healthcare, not just because they're healthier, but in terms of that generation, they're not as trusting in healthcare. They want convenience, they want low cost. Typically, they're not as loyal to one provider, not like the traditionalists or boomers are. And then we got our Gen Z, which again, 21 or younger. Generally, they're on their parents' health insurance, so others may be making decisions, or at least making a big part of the decision. They like convenience, personalization, and they expect digital. They expect to be digital, but they also lack trust in healthcare providers, maybe even more so than millennials. So with that background, what we did at Intermountain is we considered, and again, we just put this group together and they came up with these. So as you apply this to your groups, and again, you have these slides available to you just to use however you want. We, however, consider these 5 areas to be important. You know, what's the preferred mode that these individuals want to receive their healthcare? And if we know their preference, then maybe we can target them with that preference. They communicate differently on healthcare, and we want to know why that's different. With wayfinding, what this means is we as rehab providers typically help patients find their way through the healthcare, right? In the US, it's extremely complex, but we help them recommend appointments or next level of care, or we do a lot of things to help people navigate through the healthcare. And we wanted to know, are there differences based on these age categories, so we can do a better job of that. Transparency of cost is really becoming more and more important, but communicating that, what do these individuals expect? Does someone who's 75 expect a different communication of cost than somebody who's 20 in general? And also shared decision making. So when individuals need to decide what the next level of care is, or if they need a procedure or something, how can we interact with them so that they become part of that shared decision? Okay, so what we're going to do here is we're going to start with traditionalists. And I'm going to go a little slower with this traditionalist, but then the format for these other groups is very, very similar. So then I'm going to pick up the speed because, again, you've got the slides, you'll have these slides because I want to get to the discussion. So we talked about the traditionalists in their preferred mode of delivery. Okay, they are typically quite loyal, at least we found quite loyal to a provider. They tend not to miss appointments nearly as much. And I don't know what it is in your group. I'd love to hear about the discussion, but when they set appointments, they're the highest attendees for us here at Intermountain. They're also tend to be more compliant with the recommendations. So if we ask them to do exercises, they typically are more compliant to do it. And maybe it's because they have more time to do that, or maybe they're really focused on their health. I don't know, but they tend to be more compliant. They tend to prefer a meeting in person. And I don't know with your groups, but as we, really restricted in-person visits with COVID in the height year and a half ago, and they went back to more in-person visits, the older individuals were the first to say they wanted to come back, even though they would have been at higher risk for the virus. They wanted to get back to meet with our therapists individually. And they tend to prefer the same therapist, the consistent staff, and the same time. They like to schedule at a certain time each time. And again, this is the majority of the patients I see are in this age category. And I found that to be the case. And they even like one provider per lifetime. If even if it's a specialty, they would ask, well, can't you do that? Can't you treat my hand after surgery, even though you've been my back therapist. So they like to stick with one person. In terms of their communication considerations, again, some of these are going to be a little repetitive, but they like to see the same person. So if we're communicating that a provider is going on vacation, what we found with these traditionalists is we had almost rather stop the treatment and say, we're just going to reschedule you in a week when your therapist comes back, because they tend not to want to see somebody else. So we consider that when we communicate in that way. They tend to prefer, not always, but printed exercise programs as opposed to getting on an app or using some kind of a virtual video exercise. They like them to be printed out. And they need the caregiver to outline the time that they have and what will be accomplished. They like to know what's going to happen. You can't just fly by the seat of your pants in general with some of the traditionalists in communication. Okay, so in terms of wayfinding, the caregiver, as you know, if you've worked with these individuals, they need to act as a care coordinator. And it may be that you have somebody hired to do that. In an acute or a SNF environment, that you probably have that. In the outpatient, you may want to designate, a front desk person or someone that can really help this group of patients navigate through the system. When we recommend other individuals that they're going to work with traditionalists, we really want to manage up, right? We want to say, hey, you're going to be working with Susie next week, or I'm referring you to this provider for this procedure, and they're really good. They like to know the experience of someone, and even encouraging that the person that they're going to see, and encourage a reputation that they're referring to. Give them a personal endorsement. That tends to help them attend and get to that care a little bit better. So with transparency of cost, this group, at least when we've done our focus groups and worked with them, they are more apt to ask if a procedure is covered by Medicare. And unfortunately, this group, if it's not covered, can sometimes say, well, they just don't, I'm not going to go, or they don't go. So it's good that we need to follow up to say, look, we sent you to this other procedure. Did you get there? And if they hesitate, it may be that they have concerns with cost. They need really simple explanation of costs. And again, in our billing system, it's not simple. I mean, you get bills from 5 different groups, and they don't seem to add it up. And if you pay one, then you didn't pay the other. And sometimes these individuals need explanation, because they tend to take a lot of pride in making sure that they pay their bill on time. They just may need help to figure it out. So with transparency of cost, you need to consider that. And sometimes they just look at what their responsibilities, not the overall cost. So that may need to be explained to them. Okay, so next, shared decision making. They need to be included in the shared decision making, and they tend to like data or explanations or examples and how it relates to them in their current function. They may need guidance with different options, so that they may say, well, look, Mr. Jones, if we go this rate, this is what is going to happen. If we go this way, this is a different approach, and they need to know that. Sometimes we found that these patients who are in this traditionalist area just think, well, the more you do, whatever it is has got to be better. And they may need some explanation on more may not be better. It may be that less is better. And again, both their desire for independence and their desire to stay home needs to be included, we feel, in this communication of shared decision making. And I'll just give you a quick example. My father passed away 6 or 7 years ago, but right before that, he went in for a hospital admission. And I was really grateful that the team of physicians, the cardiovascular surgeons got together. He had some aneurysms that were pretty severe and some issues related to that. And they just said to him, hey, Mr. Hunter, you probably in your current condition have about 6 weeks to live. And we can do these procedures. These are going to be complex. They're risky. And even if you come out of the procedure alive, you're probably going to be confined to a nursing facility for the rest of your life, or at least under pretty intense care. You would have probably a longer period of life, but this is what it would be like in terms of independence, and you may not be home. The shorter one, even though you have less time to live, you could probably spend that time, more alert and with your family and more active. And I was glad that was done. My father decided the shorter route, and right, he passed away within 8 weeks, but that time with us as a family was at a much higher level of his functioning. So these types of individuals, need that. Okay, so I'm going to go a lot faster now. So you've got these 5 different areas, right, that we went over: communication, motor delivery, shared decision-making. So now I'm going to just jump to the boomer group again. So this is my age, right? So this is folks who are, between 58, roughly 57, 58, and, up into their mid 70s. They have very similar things in terms of the mode of healthcare delivery. They're similar to the traditionalists. They do prefer in person, and they may be giving healthcare to others, so the mode of delivery may need to be focused around that. They're a little less rigid on scheduling than the traditionalists, and they're more open to virtual, but that just depends on the person. So as we've trained our caregivers on interacting with boomers in terms of healthcare delivery, they really need to ask preferences, because they may say, I want to just see the person in person, but they may be a little more progressive and say, I'm fine to do a virtual visit. In terms of communication, they use more technology than the traditionalists. They have a little more provider trust, but they're not quite as loyal as a traditionalist to healthcare providers. And as people get younger, our experience is that loyalty goes down and starts here. You may consider in communication printed things, but they may be more open to communication through an app or some kind of a digital format. They do like things to be very personalized, and again, this group has a lot of technology, but it may be that they need some simple direction in terms of communication. In terms of wayfinding, what this group that we work with found is they may need a little more simple, if it's online services, it may need to be fairly simple and easy to access. And they still need a fair amount of personal communication. They want specifics in terms of where they're going to go if they need to go to navigate to a different level of care or a different area. They definitely ask friends and family for more of their opinion, as opposed to the traditionalists, which may just ask the physician what they think, and that may be the keeper of all knowledge. But this group, even though they asked, they're interested in what the physician, the friends and family may be as important to them. And also, the caregiver may need to ask them the direction and the guide they want to go and guidance, and get more input on this wayfinding. With transparent costs, they're a little more worried about the healthcare costs, because they're in not just Medicare, but traditional plans that may have high copays, that type of thing. And this group is more cost conscious. They may not be able to afford it. So talk about cost, that needs to be clear as to what the expectation and what their coverage is. In terms of shared decision-making, again, I'll just cover this fairly quickly. They want guidance. They still trust the provider's opinion, but they are starting to do more online access, and not maybe quite as trusting. Again, this is a busy group, and so they want to know if their healthcare is going to be, impact their lifestyle. With preferred, okay, so that's that group. So we're going to jump now to some things that you may consider with the Gen X. And again, this is the 65 to 80 born, and so these folks are, early 40s to late 50s right now. Again, we mentioned that they are typically one of the best and knowledgeable groups. They value healthcare. They're efficient. They're at the height of their careers a lot of times, so they want to get in and out. They're much more technical and have access to more technology, but they're juggling schedules. They've got kids that may be at home still. They may be caring for others. They're typically the busiest group that we work with. They need a plan, and they also are still, because they're still in their career, the height of their career, the treatment may need to be focused on how they can stay at work, whether they have a manual labor job or a job that requires a function that we are working with them on as rehab providers. They get that link, as opposed to some of the others that are entering in retirement. And they're also beginning to think of their long-term health. So some of the ways that we want to provide healthcare, we maybe want to be thinking long-term, not just short-term, and as some of the younger are more focused on. So again, they want to be more efficient. They're probably more likely to use technology. They are individuals who are busy, so you may want to communicate with them on how often they want visits, as opposed to just what you think as a provider. And they're going to be more honest if they're not compliant. So typically this group is like, nope, didn't do my exercises, and that's good. Well, good and bad. We want to make sure that we ask them a lot of questions as we communicate. In terms of wayfinding, again, quick and easy, get me in, get me out. They're willing to do course corrections if needed. They're more independent, and they tend to really know what their insurance benefits are. Unlike some of the other groups that are a little older, they may not be aware of some of their benefits, and we may need to communicate that. And this group also tends to be, because of how scheduled and busy they are, they tend to be less patient. And sometimes, our front desk needs to know that interacting differently with this group is that you need to be more patient with them if they can't get things scheduled the way they want. This group definitely shops around. They do a lot of online purchasing, so they do it for healthcare. There's less loyalty than the other two groups, and they're always looking for a good deal. And so if your healthcare involves out of pocket for them, then you may want to consider that when you're talking about the cost of things. And they're also more apt to stop. If things aren't effective or it's too expensive, they may just quit showing up. And then we may need to know that. Within shared decision-making, this is a group that wants to be heavily involved in their shared decision-making. So listening and involving them more in using data and explaining the value of what you're doing and making sure that there's an efficiency discussion, with that. So, okay. So the millennials, yes, millennials, and I'm getting into where my kids, again, I don't feel like I'm an expert in these age categories, but I have 9 children and they range from almost 40 to 20. So I have kids in 3 different of these age categories. So definitely have millennials. They typically are people who bounce around. They've probably seen multiple caregivers. Somebody's not who they like, then they'll go somewhere else. They do get a lot of input from family, friends, but they get a lot of information from the internet, and that's good and bad. I mean, they come well prepared because they've looked at your ratings. They know what the internet says. They've looked at WebMD. They've made their own diagnosis, but they also may be misinformed because of the information that's on the internet may not be all that accurate. They may not tolerate multiple caregivers giving them inconsistent information. So you may have to talk about what they've heard from others to decide your own mode of delivery based on their past experience. They typically are open to outcomes and data, but they want to check it out first. They want to, verify. And they typically want fewer visits. They want a very convenient healthcare. And so we found that this group is really much more open to less frequent visits if they're doing well. So in relationship to communication, they can be impatient. They typically, want to give me the message and give it to me quick. They, again, may respond much more to text versus emails. I found that I do some volunteer work with this age category, and they never look at their emails. They look at their texts, so I tend not to email things to them. They may need to know how to find you, and they may want to initiate communication rather than have you do that. And they do what their friends do, so they ask and they get a lot of opinion. And this is the group that is typically very healthy. They're active, and so if we can communicate that the treatment is going to increase their activity or link it to that, then they may be responding better. In terms of wayfinding, again, they tend to avoid care if they have to. So scheduling them out is maybe not the best way, but just to see how they do and adjust the schedule based on their improvement. Again, they're very social media driven. They like things that this age group really is supportive of, things that promote diversity in the environment. And so that type of approach they may relate to. And they're much more apt to post negative views based on that age group. And they also look at healthcare costs to see if it's really going to be worth it. So in relationship to transparency of cost, they're very similar to Gen X. They shop around, they're less loyal, they look for online deals, and they're more apt to stop treatment if the cost gets too high, and the caregiver may need to make sure they're including value in the discussion with them. And related to if they need to if you need to recommend other types of care and get them in the shared decision, they need a plan, giving them options, but they want to be independent. They want to listen and then decide for themselves typically. So knowing that can be helpful in terms of how you interact. They need to feel that they're heard, that they're part of it, and that you're not just telling them what to do, and then feel that value. Okay, so then the last group here is our Gen Z. These are individuals typically 21, 22 or younger, and they probably want an app. They want less person. They're more open to delivering care that is less. They're again, they don't trust healthcare, and to trust, they may need to relate. We consider scheduling this younger group with sometimes younger therapists because they tend to do better with them, but that's just our experience. Their care plan may need to include a parent because they're paying for it. So we want to make sure that the delivery includes the patient or the parent. In terms of communication, this group really thrives, what we found on positive reinforcement, giving a lot of feedback. Hey, you're doing your exercises great. This looks good. They may not care about data, especially if they're in their teenage years. And they may need to experience that they're improving rather than just report it. So we do a lot more functional tests with these patients than self-reported testing. And it may be that they have to try things on their own and realize it didn't work or fell safely with something because they really have an opinion that they want to do it. In terms of wayfinding, they understand the healthcare system the least. They may need more guidance, but it may be that you have to interact with their parents, since that's really who's paying for this. And they may not care about the cost because it's like, well, my parents are paying for the copays or whatever. But you may just have to find out if they have some financial responsibility, and that may change their interest. And then lastly, on shared decision-making, this is where family involvement needs to be included, and make sure that even though they are like, well, I can make this decision because they may not be paying for it, that you involve the parent. You want them to feel like they're independent, but you also need, to get their opinion. And again, you may need to explain in a way that they can take ownership. That they may not have thought through their future. They may think they're invincible, and they may just be a little short-sighted in terms of thinking for the here and now as to how the care that we provide may be helpful for them in the future. Okay, so that was a lot of information. And what I'm going to do is two things. I just want to show a quick video. It's only 2 minutes, related to how engaging the patient is so important in providing extraordinary care. As I mentioned, that's a big focus of Intermountain Healthcare. And so I want to show this 2-minute video, and then, we should have, 20 minutes to open up some discussion. So, and Christy, let me know if this does not come through or if you can't hear.
Perfect, Stephen.
All right. I hope that came through. I can hear it on my side. So I think this is where, I'd love a discussion. And Sabrina, I don't know if there's some questions in the chat, but I would love feedback from this group on if you're already doing this. I mean, are we already considering age preferences and expectations when we interact with patients? Maybe it's just that Intermountain that we felt, we don't always do that. And then you have the slide deck again. This is just some ideas from our group, but I would hope that you would just use this for discussion. The folks at Intermountain that have used this have split this up and used little segments, maybe one age group at a different staff meeting to cover that. So there's different ways that you could do it, but I'd be interested in your ideas to train therapists, and then also, how we can best use this information to engage patients. So.
So as a reminder, because everybody is on mute, Stephen, that was absolutely incredible. It was a lot of really great information. I know it's something that probably many of us are not really thinking of and focusing on, as we're still kind of in that COVID mode. But I think this is a really good reminder and really great information. I know personally, I love that phrase wayfinding. I hadn't heard that before. So I thought that was a great phrase that you had in there. As a reminder to all participants, Christy did put a link to the handouts in the chat for everybody. And if you have questions, please type those into the Q&A. And then because everybody is on mute, we would still like to have a lively conversation. So if you could answer Stephen's questions for the discussion in the chat, and then we will we will read those. So the discussion questions were, do we currently consider age preference and expectations? What is the best way to train therapists? And how do we use this information to meet the patient where they are and better engage them? Oh, and Christy just shared the handout again. That is a common.
Yeah, I'd love your thoughts on this from folks here on the call.
So the chat box is open. If you are currently using this method to engage with your patients, please drop us a yes or no in the chat box.
So maybe to get people thinking too, Stephen, did you try at Intermountain, did you try this out with a select group, like a select department, or as kind of a pilot to see, or did you kind of just go, everybody got the training all at once?
Yeah, good question, Sabrina. I mean, we did this with my team initially, this internal process control team, and they are all, except for one person, providing care at least one day a week. So they're we're using some of this in the way they interacted. Then what we did is just ran it past our leadership team, and they made some good edits and some changes. And then we've just made it available to our different groups, from our acute to IRF to home care to outpatient. And so I haven't, I know that they've used it and done it in staff meetings. I haven't heard a ton of feedback from them in terms of if they feel that their engagement, is a lot better. I know that we still have a ways to go to get our patients to attend all their visits, or at least on the recent study that we did, we've got a long ways to go, but that's kind of how we did it here.
Do you anticipate, or are there any conversations that it would be part of maybe like new hire orientation?
Yeah, that's a good question. We have not done that. So that would be a great way to use it, to bring on new people. Good idea.
And we have we do have a comment. Lots of great kudos to you, Stephen. It's really great information. Do you have any data to say if the information has increased patient engagement?
Yeah, that's a good question there, Marianne. We don't right now. We are trying a lot of different initiatives, and so I'm not sure. I mean, we're really trying to do an initiative to get patients to come to our therapist first, rather than to go through primary care to get to us, especially for back pain. And so we think that may have a bigger influence. So I'm not sure how this is effective. I'd love if people try this to see what, one, the response to providers is, and then two, if they notice, they're observing any of that behavior change, and if it seems to engage patients better.
And have we experienced a decrease in the cancellations with the staff that have had that training too?
Yeah, we haven't measured that long enough at Intermountain to know if that's happened. We'll see, but so good questions, and it's for us, we don't know.
And sorry, I'm going back and forth. And somebody else said that they are doing this to some degree, training with their therapist by utilizing emotional intelligence training.
Yeah, I'd love to know what that is in terms of emotional intelligence. Yeah, that'd be great if that person could explain a little more about what that is.
Oh, this is a good question. Do you use this information when making marketing decisions, for example, more or less digital marketing efforts?
Yeah, so we are doing that. And I think for those of you that may have marketing experts, they do this already, right? I mean, we know that advertising is typically directed to certain age groups or certain people that, you know, are more likely to purchase something. And I know that our hospital, when they decide how they're going to, you know, market our brand, Intermountain's brand, if they're targeting a group, you know, that's say the millennials or the Gen Z or whatever, they're going to be using more digital format. If they're targeting traditionalists, they're going to use other approaches, you know, maybe television advertising or, you know, even mailers. I would assume that traditionalists are probably more likely to open their mail and read something than Gen Z. Okay. The mail that comes to my kids to my house, they never open it. They just throw it away, Dad. You know.
So another question, that's funny. Another question was, how have the different, you know, generations, because even within your own employees, you're going to have not just your patients being in different generations, but your employees are in those different generations. Has everybody been, you know, receiving it well, or do you have like maybe the millennials aren't necessarily, does it help them in understanding the different generations more? Is that what you're finding in the way that it's being presented?
Yeah, another good question, Sabrina. So when we had the group that came up with this, we had people in the different age groups, and there was really good input from the younger individuals that said, hey, you need to really, you know, when you're working with our age group, you need to consider this. And that was helpful for some of us that are in the older age groups to say, okay, we sometimes forget that, you know, both our providers and the patients just simply think differently sometimes than you know, a traditionalist or, you know, somebody that's in an older category, millennial. And so we did get good input from those providers that are younger. I haven't heard that they may, you know, accept it anymore or any less. I mean, the feedback we've gotten from individuals is, oh, this is really information and not something I necessarily think about when I'm communicating with a patient, that, oh, they may, you know, I mean, I think about it when I'm printing out their exercise, that somebody that's a traditionalist, a millennial may want it in printed form, but I haven't thought about it and how I communicate with them. And so I think that for us, that was a good step. First step is that it was kind of an aha for our providers that, oh, this could, like, if I did this, I maybe I could engage a patient better.
I think it's a very good point, right? It's definitely something, especially we're dealing with all types of different communication barriers with the masks on, right? And the way that, you know, even those nonverbals. So
I'd be interested if people could put in the chat how they see using this, right? I mean, do they see, you know, breaking this up into, you know, this is a lot of information to go over all at once, right? But if you picked, hey, we're just going to focus on the millennials today and let's talk about them. And again, don't believe everything that's on these slides, because this is just mostly opinion from people that we had. And it's certainly influenced by a lot of things, including your upbringing and the part of the country where you're raised, your age itself. But I'd be interested if people are like, could use this in staff training, and if so, how, some ideas on how they do that. Anybody wants to?
A very good point that you made, because I think it would be really great to use it as a facilitated conversation, you know, as that stepping stone, just having some of those ideas. There is a question. Do you utilize any strategies to help remind and trigger your clinicians to consider facilitating different experiences to patients within the separate age groups, and any standard works or suggested scripts or treatment concepts?
That is a really good idea. Looks like Gary sent that out. We haven't done that. We just have, again, we developed this last year. We got the PowerPoint put together, got it through leadership and sent it out. So it's been out in Intermountain's use for about 6 months. And so the scripting is not a bad idea. I mean, especially if people struggle with that, the front desk or even providers to do it. We haven't put up visual reminders, but we could do that. I mean, the one slide that shows all of them on the same slide. And, I don't know if I put that in your clinic, but in the staff, in your staff room, you could put that up to remind people to interact, consider that when they're interacting with people. I mean, these are good ideas. Some stuff I'll take back to our group.
Yeah, it'll be really fascinating to see kind of some of these data points that they're asking, to see the when you redo perhaps that study. Another person said, definitely, I think training our front office staff separately for patient intake onboarding processes, paper, written versus digital portal, then a separate training with therapists specific to patient care considerations. I think that's a great idea.
Yeah, I do too, because I think your front desk interacts with the patient differently than the provider. The provider's going to be doing more shared decision making and more communication related to treatment, where the front desk is really helping schedule, follow up, and I think both could be used, but they're really approaching the patient differently. So, I mean, Brenda, that's a great idea, to separate that. And I think, as I recall, I know that we initially rolled this out to providers. I'll have to follow up to see how they've been doing it with our support staff.
Great questions and comments. Any other questions or comments that anybody has for Stephen?
Well, I hope it's helpful and you can use this. Again, feel free to take this information and use it any way you want. The video that you saw is not in the PDF because it's, obviously it's not in the PDF, but if people are interested in the video, I'll see if it can be put out on YouTube so that it makes it accessible. It's a video that we used some time ago at Intermountain. It's probably 4 or 5 years old, but I really like it. Just because I think it helps promote that we interact with people differently in a touch, or just the way we talk to someone can make a big difference in how we do it. So
I agree. It was a great presentation, great information. Everybody is complimenting you on that, and it was really great information. Christy also provided everybody a link to where you can find the handout. That will be the same link that you could access the recording once the recording will be available. The recording via Zoom link should be sent out by end of day on Friday. So check your email for that. And then it will be available via this link for our NARA members in the NARA portal by Thursday.
And before I close too, because I noticed Kevin is one of my team member who's on the call, and I think Sabrina, you and Christy have worked with Kevin. He's our technology guy. He really helped me format this so that it would work, especially the recording. So I appreciate Kevin helping me here at the last minute. I think many of you have met Kevin. He was at our last NARA conference in Vegas.
I was just saying I put the video in the chat there, so if anyone's interested, you can download it. It's really small.
Nice.
Thank you.
I've also
Christine.
downloaded it too, so if somebody isn't able to access it in the chat, then I can email it to them, or I'll put it on the quick links.
Perfect, thank you. Okay. Well, thank you so much, Stephen. That was incredible information. I think it's perfect timing as everybody really is starting to focus on, you know, post-COVID and how do we refocus and re-engage. And I think this is really great information. So thank you again, Stephen. And thank you, Kevin, for assisting. Appreciate that. Have a great day, everybody.